Good afternoon, guys. My name is Daniel Pardo Hernandez. Today we're going to be performing a physical assessment of one, sitting right here. Here is the photo release form signed by the patient. Okay, so now we're going to do a 360 scan of the room. Person holding the camera. 1. Okay. So I have already washed my hands, applied some gloves, provided privacy for the patient, and now I'm going to address him. Good afternoon.
Hi.
Can you tell me your first name and date of birth?
Juan, January 20, 1972.
Okay. Do I have your consent for treatment today?
Yep.
Okay, I want to ask you a series of questions before we start the physical assessment. Is that okay?
Mm-hmm.
Okay, do you know where you are?
Yes, at home.
Okay, do you know what time it is approximately?
1 o'clock.
Okay, and can you tell me your full name?
Juan Pardo Diaz.
Okay, do you know why I'm here?
Yeah.
For a physical
For
assessment?
physical.
Okay, good. So, as we can see, the patient is alert and oriented times 4. His mood is content. His behavior is being very respectful. His speech is clear. Sir, do you have any history of IBS?
No.
Okay, what about lung cancer?
No.
Okay, patient be nice. Examine the patient's appearance. He is dressed appropriately for the season. No holes observed in the clothes or dirtiness whatsoever. Okay, so moving with the head, we can see that the patient's color of the head is even, with the exception of some small primary lesions like this mole right here. It is a flat lesion, less than 1 millimeter or about a millimeter, or this flat decoloration on the scalp. The skin is brown colored. So assessing the facial features, we can see that the ears are aligned with the eyes. The eyes are aligned as well. The nose is midline and the mouth is aligned as well. Can you raise your eyebrows for me? Okay, so we can see the eyebrows are aligned as well. So examining the scalp, we can see that the patient is bald, but the hair follicles are distributed through the left temporal, following the occipital, going to the right temporal. So now we are going to take a look at your eyes. Can you please pull your eyelids down for me? Okay, so we can see there's no discharge or lesions on the conjunctiva. The sclera is white, with the exception of some venous presence around the eye. Okay, so now I am going to assess your eye coordination. Can you please just follow the tip of my pen only with your eyes? Okay. Okay, so we can see the patient's the patient's eyes move move at the same time, and they follow the tip of the pen. This is to assess the cranial nerves 3, 4, and 6. So now we're going to take a look at the patient's pupils. So we can see the pupils are about 3 millimeters in diameter. Both are equal. They are round. And now, sir, I'm going to assess your pupil constriction. Okay, I'm going to start with the left eye. I'm going to need you to look straight over my shoulder. Okay. Another one. Okay, so we can see the patient's pupils constricted when they were shined with the light. So now we're going to do the same thing just to see if the opposite eye that is not being shined with the light constrict as well. So one more time. Shining the left eye and looking at the right eye. Okay, now the other one. So the pupil's constricted with the indirect light, which is a normal finding. So now we're gonna move to examine the accommodation. Sir, I need you to follow once again the tip of my pen. Okay, so as the pen was getting closer to the patient's eyes, he succeeded at following the tip of the pen, and the pupil constricted as well, which is a normal finding. So now we're going to move down to the mouth, inspecting the patient's lips. They are a little bit dry right now. They are brown and pink in color. Sir, I'm gonna have you to open your mouth right now. Okay, so we can see the patient has some dental work done, especially on the molars, and he has a crown as well. I'm gonna take a look at your tongue really quick. Okay, so we can see the patient's tongue. The patient's tongue is moist, no signs of lesions or discharge. Can you say ah for me? Ah. Okay, the patient's tonsils are grade 1, no lesions, no discharge, and so is the throat, no lesions or discharge. Okay, so now we're gonna move down to your neck. Can you please raise your head just a little bit? Okay, so we can see the trachea is midline with the body. And can I palpate, palpate your neck? Okay. Okay, no masses or abnormalities will palpate it. So now I'm gonna have you sit in this chair right here, sir. Okay. Can you please raise your shirt for me? Okay, so inspecting the back, we can see that the spine is midline. I'm going to palpate really quick. Okay, no abnormalities are noted with the palpation of the spine. He has no masses or anything else uncommon. Sir, I need you to take a deep breath for me. Okay, one more time. Okay, both lungs expanded correctly. So now I'm gonna listen to your lung sounds, and every time I place the stethoscope, just take a deep breath. Okay, both lungs sound clear bilaterally throughout all of the fields of the lungs on the posterior side. We're gonna do the same thing from your chest. Can you please pull your shirt up? Take a deep breath. Okay, again, patient's lungs sound clear bilaterally throughout all the fields of the lungs anteriorly. The patient's air source is is room air. He's not. He doesn't have any problem with breathing. Otherwise, he would be using accessory muscles such as the trapezius or the latissimus dorsi. Okay, sir. Now I'm going to have you to lay on your back. Okay, thank you. Can you pull your shirt up? Okay, inspecting the abdomen from the side, we can see that it is flat. Some pulsations are noted. Then looking at the abdomen, we can see that the color is even throughout the four quadrants, with the exception of some primary lesions, like this moles over here. They are all flat, and the color of the skin is a light brown color. So now I'm going to listen to your bowel movements. Sir, do you have any pain right now? Do you have any pain?
No.
Okay. Okay. So if the patient had any pain, I would leave that quadrant for last and move clockwise. So now starting at the lower quadrant. Okay. I could listen to about 7 to 8 bowel movements. So now I'm gonna, if I have your permission, I'm gonna palpate. Okay, so starting at the right lower quadrant. Okay, so the abdomen is soft. It is non-tender, and the patient did not present any signs of guarding. So, sir, you can pull your shirt down, and if you can stand up for me. Okay, so now I'm going to perform a blunt percussion to the kidneys. Okay. Does that hurt? What about that? Okay, you can put your shirt down. So you may sit down now, thank you. In the hospital setting, I would help the patient get back to the bed if you needed to. Lower the bed to the lowest position. Raise the side rails ×2 and place the call light in reach. And then I will go to my station and document my findings. Thank you.